Good morning, everybody. Thanks for tuning in again. Doc Dave here on Call with Doc Dave. And today we're going to do episode number 21, which is labor and delivery. So congratulations, you finally made it to the labor and delivery stage after going through the first, second, and third trimesters. So, signs that labor is beginning to start. Okay, usually 95% of the times labors begin naturally. Occasionally they need a little jump start with some, oxytocin, which is a medication that helps to stimulate the uterus to go into contraction. But that's only usually used if there's any perceived complications or if there's a delayed delivery past 40 weeks. But let's stick with the natural timing of the labor. Usually it's between 37 and 41 weeks. The uterus starts to tighten and it causes contractions. You can just feel it tighten and buckle up a little bit, and then you'll feel the contractions. At first, the contractions are pretty painful, and as they increase in frequency, they increase in duration, and then the labor really starts to go into an active labor phase. At first, they are about usually 10 minutes apart, something in that range, and lasting anywhere from 45 to 60 seconds. And then they progress to only several minutes apart and increase in duration and increase in intensity. So, it starts off kind of slow, then it gets progressively more intense. Now, they always tell you to time your contractions. Well, what does that mean? That means that you go to the hospital once the contractions are anywhere from 5 to 6 minutes apart and it's your first pregnancy. You don't want to have to necessarily go in when they first start at 10 minutes because you're going to be in there for a long time. So you wait till they're about 5, 6 minutes apart, you're timing them, and then in the car and off to the hospital. Now, when would you go sooner? Well, if it's your second or greater pregnancy, then the timing gets shorter. So instead of 10 minutes apart and taking, a few hours in labor, they're going to be much quicker. They're going to progress from 10 minutes to 4 to 5 minutes to 2 to 3 minutes in a much shorter period of time. And I'll go over that in a little more detail later. So if it's your second, third, or fourth pregnancy, you start feeling the contractions, you should get ready and go to the hospital immediately. Now, labor, what is labor? Labor has 3 different stages to it. There's the dilatation stage, which is the longest stage. It's when the contractions first start and you start to dilate the cervix so that the baby's head can pass through the cervix into the birth canal. Then there's the expulsion phase. That's usually 30 to 60 minutes. And that's once the head is in the canal and the baby starts to come out of the birth canal. And then there's the placenta phase, where the placenta separates from the uterus and gets passed through the birth canal as well. So, what kind of things influence the various stages of childbirth? First and most important, it's generally if it's your first baby, it's going to be a process. If it's your second, third, or fourth baby, not only do you understand the process, but it goes much faster and much more efficient. So, and then there's active labor. Well, active labor is the first time mothers, usually lasting 4 to 16 hours, greater than one baby in the past, second or third pregnancy, it can shorten down to 2 to 11 hours. So that's what I was saying above. Once those contractions start, if you've had multiple babies, head to the hospital immediately because it could be an hour or 2 hours, and that's it. Now, let's go over the different stages. The dilatation stage. This is where the cervix begins to thin out and dilate. to let the baby's head pass down the pelvis and into the birth canal. The cervix is normal in a normal person, or even up to 9 months of pregnancy before you start labor, is tight and closed, and it's thick. Then it starts to dilate as the labor begins. It goes, from 0 centimeters dilatation. The first thing it does is it thins out. The cervix has to thin out first before it can dilate. So that takes a bit of time as well. And then once it dilates, it needs to dilate all the way up to a full 10 centimeters, which is about 4 inches. And that's where the baby's head will be able to get through the cervix, because it'll expand it as it pushes through the cervix past 10 centimeters. But it has to be a minimum of 10 centimeters and what we call completely effaced. Effaced means thinned out before the baby's head can start to come down the birth canal. Once it does completely dilate and the head starts to come out, there'll be what's called a little bloody show, which is a little blood in the mucus, and that'll tell you that the cervix is basically completely dilated. You'll also notice the water will break, and what that means is the amniotic fluid in the sac that's been keeping the baby safe and functional during the birth process will rupture. And once that amniotic sac ruptures, then you'll see a big flow of fluid out through the vagina. Now, the physician will do various exams during this dilatation phase. It's a manual exam, and he'll check how well the cervix is dilating. And it's a safe exam. Obviously they wear gloves, and so it's sterile. And they check and see, is the cervix 4 centimeters? Is it 8 centimeters? Is it fully effaced and dilated? Then they, got to get really prepared. And during this phase, you got the Lamaze system going on. You got your husband sitting there. He's not just sitting on his hands. He's sitting there coaching you. Okay, push, push, push. You're going to hear that a million times. Push, push, push. Take a deep breath. Push hard. Relax. That's what the Lamaze coaching is all about. So then the second phase is the expulsion phase. Now that's once the cervix is completely effaced and 10 centimeters dilated, each contraction pushes the baby's head down the birth canal. So the contractions are being very effective. They're not just contracting anymore. They're actually pushing the baby down the canal. Now, crowning of the head. What is crowning of the head? You may have heard that terminology. Crowning of the head is once the head is visible to the physician delivering the baby in the birth canal. So once he can start to see the head starting to come out, then that's what's called crowning. Now, at that point, if you're running into problems with the head coming through because, maybe it's too big or, whatever, the doctor may elect to do an episiotomy, which is where he just cuts a little bit of the skin there at the opening of the birth canal and widens the canal out so that the head will come out easier. And generally, they don't use the clamps anymore, to pull the head out. That's kind of old school unless they run into a major complication. But once they do the episiotomy, that'll open up the birth canal bigger and the baby's head will be able to come out easier. So, labor pains. Let's just talk about labor pains for a minute. What are labor pains? There's secondary to strong contractions of the uterus. Uterus is a big muscle. And when it contracts, it's contracting. And it increases in intensity as the birth progresses. So, at this point, they may offer you some pain medication. It's obviously safe. They do this, day in and day out. It's been around for, decades. They're not going to give you anything dangerous, or they're not going to give you so much that it slows down the labor. But if you're having a lot of pain, especially with the first delivery, you may elect to say thumbs up on that. So the third stage is the placenta stage. Now, The placenta, once the baby's delivered, the placenta will separate from the uterus and it will pass through the uterine canal, pass through the birth canal, and it will expel itself. You may feel some contractions as you're doing that as well, but not as intense as the labor contractions were. So now the baby's delivered. It's on your tummy. The cord is still attached to the placenta, so the doctor will put a clamp around the cord and cut the cord, as they say, and that will separate the baby from the placenta once and forever. Usually a pediatrician is on standby to do a quick exam on the baby. They do what's called an APGAR score. I won't go through all the terminology of it. You got an A, a P, a G, an A, and an R. It's all about the color of the baby, the activity of the baby, the baby's breathing effectively, and their appearance looks good. And that's usually anywhere, usually around 8, 9, or 10. 10 being the best, 8's fine, 9's fine. If it gets below 6, it's a little bit of an issue. They may have to stimulate the baby, maybe put the baby in the NICU, the NICU, the neonatal intensive care unit, just to watch the baby for 24 hours. So that's the APGAR score. Now, what kind of complications can you have? I know nobody wants to hear this, but it's really rare, but you should be aware, okay? Yeah. So there you go. You may need to induce the labor, okay? And usually that's with either a medication called oxytocin, which is a contraction stimulator to the uterus. It's given to you intravenously. You may need a C-section. Maybe you didn't plan for it. Maybe everything was fine initially, and then boom, there's some complications. The head won't come through. The baby's too big. Maybe the feet come out first. All kinds of different things could cause, a delay in labor and delay in delivery, which could be a complication for the baby as well as the mother. So they take you in and do a quick C-section. It's actually not a bad idea because it's like a 45-minute procedure versus, 12 hours of labor. So don't get freaked out if they say they have to do it. And usually the old saying is once a C-section, always a C-section. But that doesn't always hold true. And that means basically if you have a C-section, the first baby, you're going to need one for the second and third. The last thing is if you have a postpartum hemorrhage. Once the placenta pulls away from the uterus and the normal contractions would stop that bleeding, for some reason you get what's called an atony of the uterus. It doesn't contract effectively, and when the placenta pulls apart, it causes some pretty dramatic bleeding episodes. Now, those are resolved by two things. The doctor will actually stick his entire hand up into your uterus area there and start contracting it, massaging it, and doing, internal massages. And therefore, that will cause the uterus to stop bleeding. And they will also give you something called oxytocin, same thing I mentioned earlier about stimulating the labor. Well, the oxytocin will also be a medication that will contract the uterus as well to stop the bleeding. And those two procedures are generally pretty effective. So there you go. Congratulations. You got your baby. Nice, healthy, pink APGAR 10 baby. Hopefully you got names picked out already. You may or may not know the gender, but, have a male name, have a female name ready to go. And enjoy the baby. The baby's going to be hungry and want to feed right away, so he's going to be looking for the breast, sniffing around to get some nutrition. So I hope you enjoyed this 4 episode of first trimester, second trimester, third trimester, labor and delivery. And, that this was educational for you, and it entertains you, and it helps relax you now that you know what's going on. You can listen to the first one. I wouldn't listen to the second or third ones right away. Just go from trimester to trimester to trimester. That way there you just keep it in a normal progression of where you are in your stage of pregnancy. And then obviously the labor and delivery one is one you're going to want to read right before you are expected the timing to go into labor. So, thanks again for your time. Doc Dave signing out here. If you liked it, like it, share it. You got a lot of people that are friends or whatever that are pregnant, co-workers. Tell them to listen in and hit the like button, hit the share button, and hit the subscribe button, and let's keep this thing rolling. So talk to you soon.